good morning, ma'am. So I'm Anjik P. Kuba and I'm from BSN 1A. So I'm going to demonstrate assessment for the abdomen. So first, we need to assemble all the equipments that we will be needing. So I have here a examining light. So let's just pretend that this is a examining light because I don't have that kind of equipment. Then, a stethoscope, a tape measure, then a water-soluble marking pencil. So, pretend na lang na water-soluble marking pencil to. Next, we're going to introduce ourselves to the patient. So, good morning, sir. So, I'm Anjik P. Kuba and I will be your student nurse for today. So, ako po yung mag-assist po sa abdomen niyo po. So, sir, can you please state your name? Ano po pangalan niyo, sir?
My name is Jalbert Angelo Taragi.
Okay po, sir. So, how old are you, sir?
I'm 16.
Okay po. So, when is your birth date, sir?
I'm born on April 6, 2006.
So, the purpose of this, sir, is para ma-determine natin or malaman natin if there are any abnormalities sa abdomen niyo po. So, next, we're going to perform a hand hygiene. So, we can perform a hand hygiene by rubbing a alcohol or performing a hand washing. Next, we're going to provide the patient with the privacy. So you can provide the patient with the privacy by closing the door. So it is already closed, and by closing the curtains and windows. So it is already closed na. Then, first we're going to collect for subjective data. So sir, I just have some few questions to ask po. I hope po you can cooperate with me. So, sir, madalas po ba kayong nagbabawas?
Hindi na.
Hindi naman po. Palagi po ba kayo nahihirapan magbawas, sir, or hindi naman po?
Hindi na.
Iba po ba yung preference nyo sa pagkain, sir? Yung panglasa nyo po?
Hindi na. Normal lang.
Normal lang. Eh, nakakain po ba kayong nakakapahirap sa inyo para tumae or magbawas, or may nakain po ba kayong nakakapagpahirap sa inyo na matunaw?
Sa tingin ko wala naman.
Wala naman. Ano po yung kinain nyo sa loob ng 24 hours?
Kaldereta.
Okay. Nag-rice po kayo?
Opo.
Ano po ba talagang pinaka-nararamdaman nyo, sir?
Wala naman.
Dati na po ba kayong nakaramdam ng abdominal pain?
Dati. Nung last week. Or last month.
Okay. So, now we are done collecting for the subjective data. So, next we're going to the objective data. But first, we're going to assess the patient into a supine position. So, sir, assess ko lang po kayo sa supine position. Then, wait lang po, sir. Assess natin yung patient in the supine position. Then, we're going to place a small pillow beneath the client's head and knees. Then, yung arm niya nasa gilid. We're going to place a small pillow sa client's head and knees to reduce the tension sa kanyang abdominal muscle. Okay, sir. Higa na po, sir. Okay po. Then, sa knees niyo po, sir. Then, we're going to expose the client's abdomen. So, expose lang po yung abdomen niyo. Then, for the physical assessment, so first, we're going to inspect for the abdomen. So, we're going to use a examining light to inspect abdomen for skin integrity. Then, inspect the abdomen for contour and symmetry. Then, observe the abdominal contour habang nakatayo sa client side. So, let's just say na nakatayo ako kasi wala kaming high bed. Then, ask the client, take a deep breath and hold. So, sir, can you please take a deep breath? Hold, sir. Okay po. Okay po, sir. Exhale. Then, assess the symmetry of contour habang nakatayo tayo sa foot of the bed ng client. So we're going here. Then, inspect and observe lang. Okay? So, if this tension is present, we're going to measure it. Measure the abdominal girth. So, we're going to measure the abdominal girth using a tape measure. Okay. Okay, so normal measure of abdomen of the client is sa male 100 or 105 if I'm not mistaken. Then sa female 80. So 50 yung abdomen niya, so it is normal. Okay. Next, we're going to observe for abdominal movements. Then observe for the vascular patterns. So next, we're going to auscultate for the abdomen. So we're going to auscultate for the abdomen. So auscultate for bowel sounds, vascular sounds, peritoneal friction rubs. So we're going to auscultate. So we're going to begin at the we're going to begin at the right lower quadrant. Then right upper quadrant. Then observe for any abnormal sounds. Then to the lower right. Then to the taas naman sa lower left quadrant or sa upper right quadrant. Okay. So next we're going to percuss. So percuss the abdomen. So percuss the abdomen into several areas. So we're going to use a systematic pattern. So we're going to percuss first at the lower left quadrant. So percuss at the lower left quadrant. Then lower right quadrant. Then upper right quadrant. Then upper left or lower right quadrant. Then percussion of the liver. So percuss the liver. Percuss natin yung liver with its size. Para ma-determine natin yung size. Okay. So next is the palpation of the abdomen. So we're going to palpate the abdomen. So first we're going to palpate the abdomen using the light palpation. Palpate lang. Para ma-determine or ma-detect natin if there are any tenderness or muscles guarding. Palpate the four quadrants into systemic pattern. So paikot. Light palpation lang. Then deep palpation. So deep palpation sa four quadrants. Deep palpation. So note any abnormalities or any tenderness. Okay. So next, we're going to palpate the liver. Palpate the liver for any enlargement or tenderness. So, palpate natin yung liver. Palpate natin yung liver. Okay. So, next is the palpation of the bladder. So, palpate natin yung bladder. Palpate ang pubic lymphosis. If the client's history indicates urinary retention. So, palpate natin yung bladder. So, note any abnormalities or any tenderness sa bladder ng client. Okay. So, we are done with the assessment for the abdomen. So, next, the aftercare. Aftercare lang. Sa client and sa equipments. So, sir, asin ko na po yung pillow. Dagdagan ko po sir yung pillow ng ulo niya, hindi. Okay. Then, again, hand hygiene. Then, after care of the equipments. Then, we're going to document all the data that we've gathered if may nahanap tayo or may na-observe tayong abnormalities sa client. So that's the procedure and assessment for the abdomen. Thank you.